In this video, we shall have a brief discussion about fentanyl or fentanyl, whichever way you want to pronounce it. Now, when comparing fentanyl over morphine, fentanyl has got a number of advantages. It is at least 100 times more potent than morphine. It has an onset of action which is much quicker than morphine, and the duration of action is shorter than morphine. A quick onset of action and a short duration of action makes a drug ideal for intraoperative procedures. So, in that context, fentanyl has got advantages over morphine. Also, fentanyl, when compared to morphine, does not produce a large release of histamine, and therefore the associated features such as urticaria, the chances for anaphylaxis, fall in blood pressure is less with fentanyl. Venodilatation is less with fentanyl, and it is easy to use. It can be safely administered rapidly in a minute or less. The congener of fentanyl, namely sufentanil, is 1000 times more potent than morphine. So, these many advantages make fentanyl the most popular opioid for intravenous intraoperative analgesia. Now, does fentanyl have any role in the management of chronic pain? Obviously, intravenous fentanyl would not have any role in the management of chronic pain, simply because it would not be practical to prick the patient all the time for a longer period of time. So, no, intravenous fentanyl does not have any role in the management of chronic pain. However, novel, minimally invasive routes of administration for fentanyl have recently been developed, and this has facilitated the use of fentanyl and its congeners in chronic pain management. One example among these is the fentanyl transdermal patch. Now, let us assume that this is the stratum corneum of the skin of a patient, and it contains blood vessels. The fentanyl transdermal patch contains a reservoir, and the reservoir contains the drug either in solution or bound to polymer. On the upper surface of the reservoir, we have an occlusive backing membrane, and on the undersurface of the reservoir, we have a micropore membrane that releases the drug at a constant rate. You can see the drug being released into the stratum corneum of the skin in the diagram. Now, on the undersurface of the micropore membrane is an adhesive layer, and before sticking this to the skin of the patient, we need to peel off a protective film, and then you stick the patch to the skin of the patient. Now, we need to understand very clearly that fentanyl patches produce distinct effects in opioid tolerant patients and opioid naive patients. Now, obviously, any patient who has been taking opioids chronically would have developed tolerance to opioids, and tolerance is the phenomenon by which an effect that was previously achieved with a lower dose of a drug can now only be achieved with a higher dose of the same drug. So that's what we mean by an opioid tolerant patient. So what are the different effects that fentanyl patches produce in opioid tolerant patients and opioid naive patients? In opioid tolerant patients, a typical example of which would be a cancer patient with chronic pain. So such a patient would have been taking opioids for weeks or possibly months, and would have by now developed tolerance, especially to respiratory depression produced by opioids. Now, fentanyl transdermal patches do not produce significant respiratory depression in such opioid-tolerant patients. However, in opioid-naive patients, fentanyl transdermal patches are not a suitable option because it will produce significant respiratory depression even at lower doses. In addition to this, 14 to 18 hours is required to reach a steady state concentration, and therefore it is not at all suitable for acute pain. So fentanyl transdermal patches are particularly useful for patients with chronic cancer pain. Such patients have typically already been on opioids, and they would have developed some degree of tolerance to the effect of opioids, especially respiratory depressant effects. These patients will not develop respiratory depression even if the plasma levels of fentanyl are in the steady state for up to 2 to 3 days, which are exactly the levels produced by the fentanyl patches. Fentanyl patches are an excellent option for cancer patients who are already tolerant to opioids. However, if the patient is opioid naive, then fentanyl patches are of little value because they will produce respiratory depression even at the lowest doses, and they take 14 to 18 hours to reach steady state and therefore not useful for acute pain. Now, although fentanyl patches were non-invasive, they had delayed onset of action and prolonged duration of action. So these features make it very valuable for chronic pain. However, these features make it unsuitable for acute exacerbations of chronic pain, otherwise called breakthrough pain. To ensure that fentanyl would be useful for acute exacerbations of chronic pain, it became necessary to have routes of administration that were not only non-invasive, but also with faster onset of action and shorter duration of action. This became possible with rapid onset opioids, or ROOs. Now, these include oral transmucosal fentanyl citrate, fentanyl buccal tablets, sublingual fentanyl tablets, intranasal fentanyl spray, and fentanyl pectin nasal sprays. Oral transmucosal fentanyl citrate. Now, this is a sweetened fentanyl citrate lozenge. It's mounted on a stick like a lollipop, and the patient spreads the medication over the buccal mucosa. It is suitable as pre-medication before surgery and other painful and unpleasant procedures in children and adults. Also useful in the treatment of opioid-tolerant patients having breakthrough cancer pain. Fentanyl buccal tablets are effervescent tablets, and they modify the pH of the buccal cavity and enhance the drug absorption. They are typically placed between the upper cheek and gum within the buccal cavity above the rear molars. Sublingual fentanyl tablets, they contain fentanyl citrate mixed with a carrier particle and mucoadhesive agent, and it uses a rapid disintegration system and dissolves under the tongue within 2 minutes. The intranasal fentanyl spray had many adverse effects and therefore lost popularity, but most of these adverse effects were overcome with a new improved nasal spray called the fentanyl pectin nasal spray. Yeah, so in spite of its many therapeutic advantages, fentanyl is unfortunately fast becoming a highly misused and abused drug. So, to summarize, fentanyl can be given by multiple invasive and non-invasive routes. The invasive routes include the intravenous route and epidural and intrathecal routes. So these routes, when fentanyl is administered by these routes, it is extremely popular in the management of intraoperative pain. It is also less commonly administered by the intramuscular route. Now, there are many non-invasive routes of administration of fentanyl. Some of them have got slow onset of action and longer duration of action. And the typical example of this would be the fentanyl transdermal patch. Non-invasive routes of administration which have rapid onset of action and shorter duration of action include the rapid onset opioids, of which we have many examples that we discussed above. So while the fentanyl transdermal patch is useful for chronic cancer pain, the rapid onset opioids are useful for acute exacerbation of chronic pains as well as other forms of acute pain.